Hi, I'm Ross Morgan. I'm a pediatric surgeon with Strand Pediatric Specialists. I decided to go into the medical field because my father was a veterinarian and he had a great love of animals. I had more of a great love of kids, and so I decided to go into pediatrics. And as I got more involved in pediatrics, I found that the surgical area of pediatrics was really where my gifts were. Pediatric surgeons are really general surgeons for children. I did all my undergraduate training in Michigan. I started out at a small private school, Olivet College, and then went on to Michigan State University to get my degree in biochemistry. Medical school, I went on to the University of Michigan, spent 4 years there in medical school, and then did 6 years of training in general surgery at the University of Michigan as well. And then when I finished there, my pediatric surgery was in New York City at Columbia University. And I spent the first year of my residency thinking I wanted to be a cardiac surgeon and take care of adults until my first day on pediatric surgery when I took care of a 3-year-old, a 17-year-old, a newborn, took out a thyroid, did a lung operation, did a hernia operation all in one day, and at the end of that day I was convinced that pediatric surgery was what I wanted to do. The thing I like most about my job is I get to be with kids all day long. I interact with kids based on their age and what I know their interests will be at that age, and to try to allay their concerns. For example, 4-year-old, you want to talk to them about their siblings and about their pets and so forth. A little bit older school child, you ask them about their schoolwork and what they're interested in becoming. But once they become comfortable with you, then it's a lot easier to find out the things you need to know about them and examine them and find out what's wrong with them. So in children, we always try to do things that are the least invasive to the child and that are going to leave them with the smallest amount of long-term scarring. So pretty much everything we do in pediatric surgery is minimally invasive. We use very small incisions. Some of it is laparoscopic and thoracoscopic. That means a laparoscope, a lighted scope in the chest. But the net effect is you first want to do things safely, and second, you want to do it with the best cosmetic effect and the least pain and anxiety for the child. And so what I'm bringing to Strand is a new program in pediatric surgery where the parents can feel comfortable that there's experience, that the program is going to be put together in such a way that it's safe for their children and more efficient so they don't have to be driving 2 or 3 hours for something that can be easily fixed here.